Millennium Development Goals when I gave my talk to you yesterday. And the first thing to do, these all obviously started in the year 2000. And the question is, what have we achieved since then? These Millennium Development Goals were meant to be met by 2015. We've actually made a lot of progress. So on child health, it's estimated that 17,000 fewer children die each day than in 1990, but more than 6 million children still die before their 5th birthday every year. Since 2000, measles vaccines have been very widely distributed and have averted nearly 15.6 million deaths. The proportion of child deaths are in sub-Saharan Africa and Southern Asia, and 4 out of every 5 deaths of children under age 5 occur in these regions. So obviously there are geographical differences. And children born into poverty, won't surprise you, are twice as likely to die before the age of 5 as those from wealthier families. Children of educated mothers, even mothers with only primary schooling, are more likely to survive than children of mothers with no education because they don't know how to look after them. As far as maternal health is concerned, maternal mortality has fallen by almost 50% since 1990. In Eastern Asia, Northern Africa and Southern Asia, maternal mortality has declined to around 2/3. But the proportion of mothers that do not survive childbirth in developing regions is still 14 times higher than in, say, Europe. In developing regions, antenatal care has increased from 65% to 83% over a 20-year period. But only half of the women in developing regions receive the recommended amount of health care they need. Fewer teenagers are having children in most developing regions now, but progress has slowed. And the large increase in contraceptive use in the 1990s has not been matched since the Millennium Development Goals. However, there is a demand for family planning, and it is increasing at this moment. As far as HIV/AIDS is concerned, new HIV infections in 2015 were the lowest since 1991. New HIV infections among children have declined by 58% since 2001. And in mid-2016, there were 18.2 million people, which is about 46% of those infected, who are accessing antiretroviral therapy, which means that they should continue to survive. But despite this program, there's still 250,000 new HIV infections among adolescents, or there was in 2013. And 2/3 of these are among adolescent girls, maybe due to forced first sexual encounters. AIDS is still the leading cause of death among adolescents in Africa, and the second most cause of death among adolescents globally. So there's still plenty to be done. And in 2015, it's estimated that about 1.1 million people died of HIV globally. At the end of 2013, there were nearly 250,000 newly infected HIV children. And globally, adolescent girls and young women face gender-based inequalities, as you could expect, from exclusion, discrimination, and violence, which puts them at increased risk. TB, malaria, and the other diseases, TB-related deaths in people living with HIV have fallen by 36% since 2004. Between 2000 and 2013, TB prevention, diagnosis, and treatment interventions have saved an estimated 37 million lives. And the TB mortality rate has fallen by 45%, in fact, and the prevalence rate has fallen by 41% in the 20 years or so since 1990. As far as malaria is concerned, over 6.2 million malaria deaths are estimated to have been averted in the time of the MDGs, primarily children under 5 years of age. And the annual deaths have approximately halved, mainly because of bed nets. The global malaria incidence rate has fallen by an estimated 37%, and the mortality rates by 58%. So The MDGs have done a good job, but they haven't done quite as good a job as someone at the door. Could you let them in? Thanks, please come in and take a seat. So the global malaria incident rate has fallen by an estimated 37%, and the mortality rates by 58%. And those are pretty stark and good figures over a 15-year period. But the MDGs sort of expired, if you like, in 2015, and there's still plenty to do. So over the last 3 or 4 years, an awful lot of people have done an awful lot of advocacy and pulling and pushing to get these sustainable development goals. Instead of 8, there are 17. We obviously don't have time to talk about all the 17, and so what I'm going to suggest today is that we look at number 3, which is good health and well-being, health for all. So SDG 3 has as its aim, its overall aim, to ensure healthy lives and promote well-being for all at all ages. And the goals within a goal are the health targets, and these are they. I want basically to introduce this discussion by reading out these targets, and what I'd like each of you to do is to think really of the ones that we are likely to achieve and the ones that we're not likely to achieve, and then in the discussion we can say, I'd like you to all say why you think those that are achievable, and what you think the obstacles are to the ones that we're not going to manage to get to. So by 2030, as they all say, can we in fact reduce the global maternal mortality rate to less than 70 per 100,000 live births? Can we end preventable deaths of newborns and children under 5, with all countries aiming to reduce neonatal mortality to these low numbers, which are much lower than currently, particularly in sub-Saharan Africa? Can we end epidemics of AIDS, TB, malaria, and neglected tropical diseases? Can we combat hepatitis, waterborne diseases, and the other communicable diseases? It seems to me that, don't want to bias you, that's an awful lot to do in one sentence. Can we reduce by 1/3 premature mortality from non-communicable diseases by prevention and treatment? And can we promote mental health and well-being? Can we strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol? Hopefully they don't want to remove the nice use of alcohol. Can we halve the number of global deaths from injuries from road traffic accidents? Can we ensure universal access to sexual and reproductive health care services, including for family planning, information, education, and the integration of reproductive health into national strategies and programs? Can we get and achieve universal health coverage, including financial risk protection, access to quality, essential healthcare services, and access to safe, effective, quality and affordable essential medicines and vaccines? Can we reduce the number of deaths and illnesses from hazardous chemicals in the air, water and soil pollution and chemical contamination? And can we strengthen, and I guess why we've got A, B, C and D here, maybe these ladies will tell us, but 3A is to strengthen, I guess this is not so much a target, but what we have to do to reach it. Strengthen the implementation of the World Health Organization Framework Convention on Tobacco Control. Support research and development of vaccines and medicines. Substantially increase health financing and the recruitment, development, training and retention of health workers in developing countries, especially in least developing countries and small island developing states. And finally, can we strengthen the capacity of all countries in particular developing countries, for early warning, risk reduction, and management of national and global health risks. So obviously, an awful lot of people have put an awful lot of work and pulled and pushed in order to get those SDG 3s. I'm supposed to go back. Okay. Anyway, that's all I want to say by way of introduction. And so I'll ask Francis to introduce the two lady speakers, one after the other, and then I'll leave the appropriate page up here, and then we can start discussing, first of all, the first few of the, 3, 1 to 6, and then we'll turn to the second page and have people comment on the other SDGs.
Okay? It's interesting that those targets are only for goal number 3. I think overall in the 17 goals that there are, there's something like 179 targets. When people write targets down, you sort of get a bit worried because you wonder which are the ones that are left out and which are the ones that are almost impossible. But anyhow, those are the targets under goal number 3, so we can talk about those later. But what I'm going to do now is ask Elizabeth and Julia, maybe Elizabeth, you can talk first about what they've been doing. Because Elizabeth, as I said, has done a lot of work in trying to get our government to be aware of how important the SDGs are. And the fact that I said that our government is sort of sidelining them off and dipping suggests that they're looking at them rather like the Millennium Goals. They're not our problem, they're someone else's out there. But these goals, the SDGs, are meant to be applicable to all countries because some of those apply to us. As they do to other countries, road accidents, for example, is case in point, but there are many others. So Elizabeth has done a huge amount of work to make our government aware of their responsibility as well in trying to implement those goals in the UK, as well as help through dipping with other countries. So,
yeah, please do.
Thank you very much. Hello, I'm Elizabeth Moses Moret, and I'm an advocate for sustainable development and founder of ZULU Advocates. You can check us on www.zuluadvocates.org. It's going to be a task to talk about what I've been doing and the question for today in 7 minutes. So I will ask you to please look up what we have been doing. And basically, we're taking a top-down approach and a bottom-up approach to engaging with government. When I mean top-down approach, we work with the outreach and engagement services in the UK Parliament to engage with policymakers, particularly parliamentary committees and select committees, to look at how the UK government is implementing the SDGs in the UK. And when I mean bottom-up approach, what we are doing as advocates for the SDGs, we are working with local groups. So we currently are partnering with the local Friends of the Earth group to bring the Sustainable Development Goals local, to try to push for local implementation with the local authorities. And talking about the SDG 3, like Francis has said, that so many targets, there are actually 169 targets for the Sustainable Development Goals. It's quite ambitious. We've heard all that's been read out. It's quite ambitious. I keep asking, the question is, can we achieve this? Is the question, can we achieve this? Or what improvement can we record by 2030? Last week, I was privileged to be at the University of Sheffield talking to the African doctoral researchers on the SDGs. And a lot of them seem a bit pessimistic, coming from where Africa is coming from, that, look, with what we have in Africa, we cannot achieve. So when it was my time to contribute, this is what I said to them. We can't run at the pace that the developed countries are running, because the theme of sustainable development has been in a lot of agendas that the developed countries have been working on since about 1972. when we had the Stockholm Declaration. So we've had the theme of sustainable development running, you know, in a lot of the agendas. Now we are just asking for sustainable development in Africa. So to say that we want to be where they are, that's why when you see the indicators, when we have to review all these indicators, we find out that most countries that are already performing are the countries that they're developing countries, and they're developed countries, because they're already high on the sustainable development threshold, so which we need to. But then there is hope. I'm very, very optimistic that we can make notable improvement. So what I'm going to say is, what can we do? What can we do as the research community to support this process, and this process of record, you know, change, record improvement in what we are seeing in SDG 3. And like Prof said, rightly said, there has been a notable change in global health from 1990, all the reports that we've had. There has been a notable change. And from the DFID's development tracker, we can see that in the highest, the top 5 achievements of DFID recently has been, 4 of them have been related to health. 4 of them have been related to health, and they have been majorly in developing countries, Pakistan, and 4 African countries. So there's been a lot of improvement in health. But what more can we do? What more can we do? If we say we are going to achieve, then we kind of are turning a blind eye, in my own opinion, to the idea that, you know, diseases can be very funny the way they play. You know, we've had the cases when, you know, a disease is already under control, and suddenly there's been, I mean, you know more about it, I'm not a core health person, so, but suddenly there's been a change in maybe a new strain of that disease, and then we start all over again. And this has been challenges that people working in the health sector or global health sector have really been having to deal with over time. So we need to think about things like this. We need to think about the uncertainties. Recently, there's been the case of polio in Syria. You know, when the world was just thinking that polio has been contained, you know, there's been an outbreak of polio in Syria. And now global health development funders are pulling together and saying that in the next 3 years, they want to totally eradicate polio. Is this possible? We don't know what is going to turn up next, what is going to happen next, but we just want to believe that, yes, something good is going to happen. But first of all, what I have been asking and saying that needs to be done is governance. Governance needs to improve. Governance, for me, is central to achieving all these goals, including SDG 3. And governance is not just about government. Governance includes you and I as well. It includes a contribution to government as well. You are key. If, for instance, I get this opportunity, this platform to bring people together, engage people with the members of parliament, and then I do not have people like you who come to that platform to come to contribute, maybe oral or written evidence, then, I mean, I don't know anything about these diseases. So I don't know anything about schistosomiasis, is that it? So I don't know anything about that. I don't know anything about this disease other than the bit that I read on Prof's webpage. So I don't know anything else about that. So it's practically new to me, and I'm wondering, is there really something that eats the intestines of Africans? So, I mean, it's very, very new to me, and it's wonderful. That's why I love coming to platforms like this, where I can learn and learn and learn a lot more. I really do appreciate it. So we need to work on governance. The governments need to commit. And committing is not just by paying lip service to say, yes, we want to achieve the sustainable development goals. We need to realize now that there is a lot of problems across the globe that are interconnected. Things like diseases like this are easily transported through migration from one area to another. So the world is become more and more a real, tightly knit global community. And things like either economic migration or disaster-related migration, influence migration, are bringing people across from other sides. And if we do not have everywhere where, look, we know that if, for instance, someone is traveling in from Africa with this disease, and we are here in UK, we do not have anything ready, even within the system, to combat such diseases. So we need to be ready. Governments need to put in more funding. We need to commit funding. Governance is about budget as well. So there needs to be commitment of funding. And if we look at DFID's tracker again, development tracker, we'll find out that government has committed so much to polio, actually about 300 million pounds to polio. Now, if we look at that, compared to what has been, what was contributed for schistosomiasis, which is just about 49 million pounds over up till 2018, we see that, look, there is more focus on eradicating polio. But Professor Jeffrey Sachs was saying recently that, look, this is what he thinks. He thinks that global health should be addressed in such a way that is not just, we're not just committing so much to polio, committing so much to malaria, but we are looking across all the different health issues. And we need to be more proactive as well as reactive in managing global health issues. Also, we need to improve our communication and advocacy, because we find that advocacy really has helped a lot. Advocacy has helped in terms that, look, people already know across different areas about different diseases and how to manage it. And advocacy also lies with you, because you know more about this disease, you know how it works, and you can write your research, speak out, contribute to a lot of what we are doing. So for me, I think it's not can we achieve it, but it's actually that I'm optimistic that we can make record improvements by 2030. Thank you.
Okay, and Juliet now was going to speak, and I told you that she handled the African Diaspora Forum and has also done a lot of work, I think, in the past on diseases. So, in terms of combating them, in terms of civil society anyhow. So Juliet, over to you.
Thank you so much, Francis, and the lecturer as well. Thank you. UK Africa Diaspora Forum. I'll start with louder, please. Louder? Sorry. Okay. UK Africa Diaspora Forum. Let me go to next to the mic.
Is it switched on? Just on it?
Yeah. Right. That's better? Yeah? Hello. So what does the UK Africa Diaspora Forum do? First of all, we are a forum that brings real development from a real angle, and we like to ensure that cultural Western education is also understood within the African context and vice versa. Our platform aims to bring in real change to those who really want help, and to ensure that Africa's growth and development is happening and also shaping up within the understanding between true cultural changes. Now, I was asked to sort of give you an overview of, can we develop a healthy Africa by 2030? And I think that the answer for me is yes. That is, if we are willing to change our attitudes. I want to quickly go back into the Sustainable Goals development, if we could go down to that slide, please. And I want to show you why I want to argue the case in that sense.
You mean this?
Yes, please, yeah. That's the one, yeah, thank you. So I want to argue that today you're being shown about good health and the well-being. You are all fabulous students who are here in Imperial, world first-class university or college, which is known for medicine. So what I would be looking for as a community leader and transformer in the sector of ensuring that we are achieving these goals, which I already do, by the way, is what I look for is the quality, the 17. I don't look at it from a broader, I look at it from a broader sense, but I look at it from a simply diagram, which is the 17 goals that have been drawn up to us. Now, for example, are we achieving good quality education? How many of you here would say to me we are? Are we walking in that direction of good quality education? What do people feel like in this room? Feel free, just one person? No? Okay, so good health education. I want to argue that good health education with clean water and sanitation, and there is something else here, affordable energy here, clean, because that is under climate as well, climate action, and so I want us to get a feel of understanding how important these 17 goals look to you. That is very important for you as medicine, a school of thought. So I want to say that Africa, for example, what would they be struggling with? Looking at what the lecturer has just said, yeah? The issue would be in clean water and sanitation, I would say. So if we are looking at clean water and sanitation for children who are probably having many kind of waterborne diseases and whatever, that impacts on health. So if we aim at goal number 6, then I believe we would be able to achieve goal number 3, for instance. Then we come down to climate issues if we're talking about UK and other places. What are the diseases in interventions that we need to cope in Europe has such? Asthma attacks perhaps in places like Wales that is happening. So we are looking at climate issues and actions and change. So if we dealt with the issue of number 13, that would also impact on goal number 3. Are you seeing what I'm trying to sort of like demonstrate? So sustainable, this one is very important. Clean, no poverty, I like that one. This is what everybody wants in the whole world. And I like it, but I want us to understand definition of poverty is different from different perspectives. So you've got different indexes of poverty and level. So I just wanted us to refer to that. And my argument is, what are the issues? Now I want to pose a question there. And my question is, and I think I will leave that so that you can see where we are facing here in UK and Africa. And I will refer to an article I was reading in around 2007. And it is life becoming more of a pain? Because I think that is the question I want to set. Is life becoming more of a pain? And I will refer that to it's Peter Croft sets that question a while back. So I'd like you to read about Peter Croft. Is life becoming more of a pain? And answer that question. The reason I say that is because at the moment we've got a lot of changing happening in Britain. We have got Brexit happening. So how will Brexit be impacting upon these sustainable goals development that we are looking at? I think I would like to imagine that as students, you need to be able to help us to reach our goals and aim to peak. And I will leave you with a challenge here today, that if you can, you as students, pick up on some of the goals that associate itself with goal number 3, I think we'll be able to come to a reaching angle of partnership within the World Health Organization, and what community leaders such as myself are really had and advocated for. Now let's go to the question that the lecturer asked us to look at, which ones are we achieving and which ones we're not achieving. And really, this is really crucial for you to understand as students. So the first one, by 2030, reduce the global maternal mortality ratio to less than 70% of 100,000 lives. But obviously, good partnership has been put so far. But are we going to be seeing more of resources being put into, like we saw before? Remember, changes are happening from Britain right now. There's been the issue of Brexit, so there's a lot of talk in the DFID. You will see, oh, let's cut international, that's the kind of language, let's cut international aid budget. The budget has been coming from there. So what are you looking at? Are we looking at a reduction of the number of maternal mortality rates that are happening? And we are pleased to say that we have met that kind of, presently within the Millennium Development Goals, that was met. But another thing, Millennium Development Goals, some people argue was a failure. Now there is a question of whether Millennium Development Goal was a failure, but there is also a question of the evidence that is being presented here today. The second one, by 2030, end preventable death of newborn and children under 5 of age. This is quite crucial actually, because in Sierra Leone, for example, we are seeing a number of deaths in the hospitals because mothers are dying when they're giving birth. These are the questions that the Sierra Leone community comes to me with every single time. Oh, Juliet, what can we do in Sierra Leone? Remember, there's been war in Sierra Leone. So let us think about how we stop those kind of conflicts so that there is they've stopped war and good leadership comes really effective in that sense. Then we've got, so that one, I believe that if we are able to solve some of partnership in good leadership and encourage good leadership with that one, and good management hospital, that is key in Africa. What happens in Africa is good management systems. There is hospitals. You know, I get really frustrated when I see people thinking that there is no hospitals in Africa, but there is. There must be one or two places where there's rural hospitals and we require to put more. But the essence is, what can you, how can we improve the hospitals that are already there to practically do the necessary treatments that people are doing? So that one I want us to pay particular attention in. So I would love to challenge any student here to ensure that we are meeting that, because we are probably a little bit just on the margin. By 2030, end the epidemic AIDS, and thankfully we've had that there is a reduction. The question is, how did we achieve that? And I believe that we achieved that due to lots of good people who came up. Princess Diana was one of the people who really did a lot of work in that, in memories of her. We've got very good former Lucy Kibaki, the former wife of President Kenya, Kibaki, has also done a lot of good work in Kenya. So I believe that in partnership with very good people, you are able to reduce diseases such as AIDS. But what has happened now? Cancer has gone up. So we are now seeing cases of cancer. So what are we doing about cancer in Africa? This is what is now killing people. Are we able to do the same thing as we did for HIV? Are we able to create centers that people can walk in and be treated and interventions are seen? Because this is what is happening in Africa. My father passed away with cancer, so I can tell you the systems in Africa are absolutely expensive to even run. So this is why you see people are coming to UK, or even big ministers, prime ministers want to be treated in the good hospitals. So care, if we can improve care in that area, so tropical diseases there, we're looking at dementia, even actually non-communicable diseases as well. we need to be looking at that. Yes, 2 more minutes. And then by 2030, so let's go to this one here. By epidemic disease, by 2030, reduce 1/3 premature. This is non-communicable disease, which is what I was talking about. So we need to be thinking about intervention. This is not being talked about. We're not talking about mental illness. We're not talking about chronic back diseases. We're not talking about issues that are really, 1 in 4 people suffers from mental health problems. And when your mind is not well, what happens? Other issues crop up. Asthmatic attack, diabetic. So the last one here is strengthen the prevention and treatment of substance misuse, which is what we're talking about. That comes together with mental health. And by 2020, half the number of global deaths and injuries from road traffic. I believe in UK you have a better system of roads, but what are we doing in Africa? I think that is a question of governance, as she shared. So I'll stop there, and any questions you can ask me. Thank you.
Okay, so there are a number of issues, and some that open up for discussion. But I mean, just to go through some of them that came up, I mean, really interesting. I mean, Alan went through all the areas of improvement, not all the areas, but a large number of the areas of improvement that have happened since the millennium. And those are important to realise. But the SDGs are talking about a number of things which raises a number of issues. One is, everyone's talking about a healthy planet, but it also talks about well-being. And well-being is sometimes considered something different and something beyond healthy, and particularly in the developed world. And thinking of that and thinking of the preventative things that can happen is also one issue. Another issue is an issue that Juliet raised, that although we're dealing with goal number 3, if you look at all the other goals, they're interrelated. And how you look at that interrelation is important. Another issue that came up, and I think you mentioned this, I think, to some extent, Elizabeth, and it's a topic we talked about last year when we had this meeting here. I think what we talked about, Alan said, look, if you had a certain amount of money, I can't remember how much it was, what would you spend it on? Would you spend it on concentrating on one particular disease, or would you spend it on, for example, improving infrastructure, which means that you might get better roads, better water sanitation, which might have an impact later on that's far greater in the long run than looking at individual diseases. When we took the vote, it came to infrastructure, by the way. But that's another issue that came up there. And the other issue, which I think both Juliet and Elizabeth sort of concentrated on, and was, implicit in their speech, is the relationship between science and politics. I mean, often when you take a science degree, when you're a scientist, you don't think of the political implications of what you do. You don't think of the funding issues. You don't think of, where the funding comes that actually funds your research. You don't think of how you're going to deliver these. You don't think of how government's going to organise itself, as we mentioned earlier, about embedding everything in every department, how it's going to organise itself to deliver. And you don't think, as Juliet mentioned, that management is a political issue as well. You have to get your management right. So all these things came up in what everyone said, and I think that's interesting. But now it's your turn to talk about those if you want, to do what Alan said, and is to look at those goals, tell us which ones you think are important to you, which ones you think are achievable, which ones you think are difficult, and maybe to say what Elizabeth said. They may not be achievable, but can we make a difference on the way? So, over to you. The other one then, Jessica. They've locked you in.
Right. I'm a member of Population Matters, and I think number one thing we must think of is that there are too many of us. Now, if we gave women the means and the education to know how to limit their families, we would have far less maternal mortality and infant mortality. And again, talking about having the means to do this sort of thing, AIDS doesn't need to happen if we give men the education and the means to protect themselves. That's enough for now.
Okay, so there's those issues which are ethical questions. And Jessica, you want to say something?
Good evening. I have a sort of greenhorn in this matter, but all those points in SDG 3 were really encapsulated in the 8 MDG, the National Development Goals, and their benchmark was all these things to be improved by 2015. Well, we've run past 2015 now, we're in 2017, and I'm beginning to think it's just they're trying to remind us that although we passed the benchmark with these things, but we still have to keep on because life continues. So that's what I noticed there. And sometimes I feel very disheartened when they say Africa needs this, Africa needs this. And I see from time to time that most of the wealth comes from Africa. Diamonds and all gold and all these things come from Africa. How is it to see that Africa is holding out a begging bowl to the developed countries as they say we are? And all the wealth comes from there. And they're subsidizing us for about £2,032 million, something like that. I have it, somebody sent me to let me know how Africa is subsidizing the West. So I want to know what exactly is happening and how can we be honest in helping our fellow men? Because all that happens is you have £10,000 for a project, and what happens? £8,000 goes on administration, and on the 2,000 goes to the actual project. And that's happening in life all over the world. Thank you for listening.
Alan, that was nice at the back. Alan, I mean, the charity you've got, it's been very, very careful to make sure that administration budget is very low, isn't it? And you've been a strong advocate. You're special, but you've been an advocate of that, haven't you?
Yeah, I have. But come on, let's have some of the students.
Okay,
the students are not really.
You had your hand up.
Stand up and then we can hear you. Please.
It was just one of the, when Juliet was talking about governance, which is very much something that I agree with in terms of empowering that, but also in some related to some of these issues, particularly with health, in terms of the imbalances of power and women actually being able to have power over their access to health services. And I just wondered what you thought about that, because, you know, as I understand, in some situations, women don't actually have the decision-making power within their household as to whether they do access some of the health services or the family planning services, and actually what's been done within any of these goals to mention about the imbalances of power between men and women.
I mean, do you want to respond to that, Juliet? Because in terms of Kenya, where you come from, is that a problem?
I'll stand up because we've got somebody present. What I think that, can you hear me? Right. What I think is,
Just speak.
yeah. What I think in terms of gender imbalance when it comes to good health care, that is a reality across the whole world. It's not just a reality in Africa. And in fact, we can argue actually Africa has, especially in Kenya, for the first time in Kenya, they ruled out that there has to be women representative, and that I think deserves a clap. Women representatives in the whole of the counties. So please clap for Kenya for that. Because that was an important decision for the government to take. So in helping that, what are the issues we are facing? Women feeling feminism has taken place. What are the issues they can learn from? What has been happening in the West? Women are now beginning to get abused. You are the woman, you have to listen to our men. So the challenge is, will women be able to take up the responsibility and the role that they have been given by the government? In terms of referring that into health, maternal care, family planning issues would be well catered from the local grassroots, as she is saying. We have a lot of well-organized nurses who go around and they actually really do a good job. I have seen that. But in certain Western African countries, we need a bit of more improvement, even in some of the in some of the places in Sub-Sahara. But we have got a fantastic woman who is doing what they call zero tolerance. That is the wife of the president of Kenya. So she's now taking it upon herself to do maternal care. And I think that is why we have achieved that in Kenya.
Okay.
So I was just, some of the development goals are very specific, but some of them are quite ambiguous. It's looking at 3.3, in 2030 end the epidemics of AIDS, but it's a long list. And what exactly do they mean by end the epidemics? Are they looking to end all transmissible diseases, or are they looking just to limit their spread? Or because I mean, you can read into that. In my personal opinions, you can read a lot. There's a lot of ambiguity. You can read anything into that almost.
I think of all the SDGs and all the subsections, that sentence was fought over more than all the others put together, because neglected tropical diseases, which obviously I care very passionately about, wasn't mentioned as such in the Millennium Development Goals, and everybody who was involved in it was trying to get it in there. And equally, all the other champions of all the other diseases wanted their disease mentioned. I think the word epidemic is totally misleading. What we really mean, and what we ought to be saying, is that these diseases should no longer be a public health problem. But I wasn't allowed to write that.
So you think in a way these are designed partly as a political compromise?
It's a catch-all,
yeah.
in a way, isn't it? I mean, if we could achieve all that. Yeah. But I like the lady's comment at the back that if we do achieve all those, we'll have so many people in the world, we won't know what to do. Now you've really stimulated.
Unless we men protect us. Yeah. Okay.
Just with regards to ending the epidemics of AIDS, so what we're aiming from Brighton, because I'm in Brighton Sussex Medical School, is we're moving towards being a fast-track city. So our goal with regards to HIV/AIDS in Brighton, which is two of the highest rates in the UK, are 0 deaths due to AIDS and 0 new cases of HIV. So that's what we're currently aiming for in terms of our goal.
But that's two different interventions. Preventing deaths is the antiretrovirals. And actually that figure I put up was pretty impressive, that 18 million people. But on the other hand, it's almost saying, well, it's okay to get AIDS because we've got antiretrovirals for you. Prevention, of course, is the use of condoms and other means, or even abstinence if you want to.
That's what's starting out with August, is 10,000 men of sex with men are going on that were HIV negative. So that's a growing.
I just wanted to make a point on the question that was asked before this one, and is on what is meant by some of these things. It might be easier for me to understand it if you look at the indicators. The indicators are the ways of measuring if we're actually achieving this. Even though the indicators for the SDGs are still in development, that's where research also comes in. You can use your research to influence the development of more indicators, especially on that particular target.
Francis, please could you ask people to stand up with this low ceiling and
yes, I will do that.
Soundproof.
Yeah. Please stand up and shout.
Unless
if you're
it's everywhere.
Yeah, okay. You want to project?
Well, I'm sorry, I'm a singer and I know how that you have to uncross your legs and breathe from here.
Right, can you sing your question?
It was just off the back of that. You mentioned that there's two different approaches, but the goals actually address having a universal sexual health service and also the retrovirals. And you talked a lot about having an interdisciplinary approach. But then within one point, you've got all these separate diseases, and probably everybody thinks their own research is the most important. So who's advocating the interdisciplinary approach? Who's kind of enabling that and the communication between these different departments and the health and the education? And if you have a universal health system, surely that's the basis for a lot of these points that you can develop the drugs, but how are you getting them out there, and who's enabling the communication between those different departments?
Yeah, I think that's right. The first numbers are all what we want to achieve, and then at the bottom were the letters of how we do it, and health system strengthening is one of them. I think it was Juliet mentioned about hospitals in the different areas. There are hospitals, but really people can't get to them. it's the transportation that's lacking in those rural areas. Many governments will say, we have one health centre for every 5,000 people. But what it really means is there's one health centre for 500 people, and there's 4,500 people who can't get there. I don't want to speak anymore. I want people from the... Stand up, please.
Sorry.
Otherwise that lady at the back will sing at you.
So this is going on from the comments made on hospitals. And what does everyone think the role that NGOs and other charities, development institutions have to play in this? Because in some areas in the world, I don't know about Sub-Saharan Africa, but I know about North India, which are absolutely saturated by non-governmental organisations. And whilst that's fantastic and people have great access to healthcare, they also serve to reinforce their own existence. And when you combine that with neoliberal policies which scale back the state, how can you ever create a sustainable national or like home health service? What role does the development industry or sector have to play in that?
Are you questioning the role of NGOs?
I'm not saying they're a good thing or a bad thing. I'm just sort of what's the relationship between NGOs, development organisations, and home governments, national health services?
Okay. Were you going to respond to that? Unless you put your hand up.
I was just going to agree with what she was saying.
Stand up, please.
Yeah.
I was just going to agree with what she was saying, because in my experience, I've come from Kenya and I've worked with quite a lot of NGOs, and lots of international NGOs actually come to rural communities but don't train people on the ground, and then actually leave the community being worse off than what they were. And I think what's important is that NGOs come and actually train communities, so you have train the training model, and it's not sustainable. So yeah, I just want to agree.
So you think they often parachute in
Yeah.
and go, yeah. Does anybody else want to respond to that, or before we come to a different question? Peter.
Okay. I've worked in the field of sustainable development for 27 years and written a couple of books on it, and I've spent a lot of time lobbying governments around the world, and the conclusion I've come to is that what we're missing out on with things like this is the how. If, for example, we sat here and thought, okay, let's just be really as practical as we can. If everybody put a little bit into a pot and looked at this and thought, well, okay, if I look at the course of my life, maybe I could spend a year working on this part, I could spend 6 months there, I could do this. If everybody can put a little bit together, then you end up producing an infrastructure. I'm talking about like a social infrastructure, not like, you know, roads and what have you. And that infrastructure many people can tap into. And basically produced a film called Eco Class Paradise Oasis, which was exactly about this. And that was screened at the Copenhagen Climate Conference in 2010. What we were arguing was that governments shouldn't be trying to get specific targets on climate change. They should just agree, to be on the same side. Because when you're all on the side of agreement, then you can fill the bits in afterwards. And so that's actually pretty much what ended up happening years later with the Paris Climate Accord. So the part that's missing from the Paris Climate Accord, I believe is an infrastructure that everyday people can tap into. Because we aren't kind of like dependent on the NGOs, and it's like the NGOs are people that have dedicated their whole lives to working for a cause, whereas a lot of people, just want to dedicate, I don't know, an hour a week, a year, 6 months. So somehow, I believe to achieve any of these or all of these, that's what's needed.
Is there a platform for that infrastructure?
There could be, yeah.
But there isn't yet.
Well, kind of. I mean, things like meetup groups are a potential platform, something like this is Facebook is. But that platform needs to be kind of worked on. I mean, I run a volunteer centre in Spain. I have a lot of students come out to stay with me, and a lot of the stuff they've learned in theory they start doing in practice. So I think that governments need to start looking at projects like that and funding them, because those I believe that are the platforms for the future. I don't think we've quite got there yet with exactly how it works, because practical centres like that can provide field work that universities in the UK can't.
There's a lady over there. Yeah, okay. Is that finished?
Thank you very much. I am an African, so I'm practicing in the National Hospital in Abuja, Nigeria. The question, can we ensure healthy lives and promote well-being for all at all ages? Just like you say, yes, with very good concerted efforts, but in our own environment, like I said, I work in an urban area, there is an emerging situation that we are not following. Healthcare is developing, yes, advancing technology, everything, and it's a global world. That's global health we've come to discuss. The issue of ethical issues, bioethical issues, and it's concerning women and children, especially in assisted conception. In our environment, many hospitals, many fertility centers are proliferating, and no monitor, nobody. My colleagues, now the golden goose discipline is absent minded. Women, as far as I'm concerned, are being used as guinea pigs because there is no monitoring. Every sort of treatment is given to these women, and so because there's no monitoring, some of them come down with terrible things. So if we are trying to decrease the disease burden on one hand, and here we are yielding disease burden in women and children, this is a very big problem that will soon erupt in our environment. There are no definite structures with definite roles to check what is happening. A situation where donors are not being screened properly. In some environments, they are screened up to 4th generation, but we are not doing that. Everybody that doesn't have HIV, hepatitis can donate. Spermatozoa bank, the egg banks, we are just doing things that shouldn't be done in this area, including surrogacy. Women are being laden with a lot of things that in future, that will be the health issue in our environment.
Okay. We both have connections to Africa, and you've talked a lot about how these can be achieved there and governance, but some of these apply to other countries. And I think secondly, a key word in the question is we. How can we achieve these things? But I kind of often assume that the we is kind of first world countries and donors and the Bill Gates Foundation and the money from that. But what's being done to include the African countries and their governments and the people there and the communities there to make it sustainable, like they're supposed to be sustainable goals? So what's being done to achieve them?
I mean, what's being done in Africa itself, or what's being done here in relation to Africa?
You mean Africa? What's Africa doing to help itself?
Yeah. Okay. How is the we being a we as a global we and not just how money is?
Yeah.
That's a very good question, and thank you for asking that. But I think a lot is being done. I think the issue is people understanding that is being done, and I think accountability and transparency, is that happening for people to see? So for instance, I set up an NGO. Now, someone earlier on asked a question about resources or something like that. And I think that what we see is the smaller sector of us. We've never had no donations. We've got well wishes. But what we do is, I get very upset when I see, let's say like I see £100,000 has been donated for just going to maybe an area where children are suffering from diarrhea problem, for instance. And that's just a practical example, you know, when I say to you cultural exchange and stuff like that. So in my village in Joro, where I came from, what I did when my dad was sick, I observed just quietly, I did health studies myself, and I went to all the local health clinics of the doctors that were there, and I asked them, what is your rates? What are patients coming here to see you with? That's just a simple exercise. I didn't write it down. I didn't sit down here and come back and give you, oh, this is what we're doing. I simply walked from maybe one place to another, and I spoke to various doctors who everybody sees within that community. And they told me at that particular time, gastrointestinal was the problems. That is what people were walking in clinics with. Children were walking in and refusing to, and falling ill because they were diarrhea. Now, simple, common sense. Even you can do it. What is the first thing that you remind children to do before they eat? Exactly. So what did I do? I went to a few, 76 schools which I have, on an email, and I said, head teacher, what do we need to do here? Every child that comes in school has to do what? We have to remind them to wash their hands. Within 2 weeks, the reduction had gone down for diarrhea. And this is something that we will sing in Western world where I live, that we want money for 100,000 for 76 schools. Excuse me? I beg your pardon. Hang on a minute. So when you talk about the relationship about NGOs and somebody, I felt I should answer that. But just before I quickly leave, it's very important for you as medical students to really understand something that I'm really passionate, which will take 2 minutes. I want you to think about what health means, because you're the future leaders. And we are getting old. So I just thought, when you first started, they taught you about health themes which are identified in the lay sector. They must have touched on that. And I think that if you understand what health is and understand it and cross-relate it to sustainable goals development, and I'll just pick up on 2. So health is the absence of illness. What is the explanation of that? If physical symptoms of illness are not evident, then individual is healthy. I'm sure they would have been teaching you that earlier on. Now, they would have also taught you health is functionable ability. There is a certain group of people we are not talking about, people with physical needs. So if people with physical needs, we haven't reminded ourselves of the holistic approach, because remember, before there was just the medical side, but now we want to take the holistic approach. So I want you to remind yourselves with the health themes and explanation. Oh, health is freedom. So we are looking for healthier nations. So this is a passionate thing that I have.
Okay. These 2 ladies. Do you want to stand up?
I don't know if it's really been said yet, but something that I think is quite important is it says it reduced the global maternity mortality rate, but we had a lecture a few days ago that, or yesterday it would be, about how when they talk about the global, they put the whole of the world together as one statistic. So of course, at the moment, the UK is going to have a much lower maternal mortality ratio comparatively to, say, sub-Saharan Africa, for example. So what worries me is that maybe you can say by 2030 that has happened because all these health advances have happened in the Western world, but has anything really improved drastically in other parts of the world that need it most? I think that's something that worries me about that it's just a bit vague. I don't know if anyone else agrees or...
Okay, I mean, so you're worried that they will report the statistics globally, and if there's a lot of improvement in Western countries, that will offset.
And it's just like tick, like, oh, we reached that goal.
You think the statistics should be broken down so you know exactly what's happening. So you can stand up, thank you.
Okay, thank you so much. My name is Precious, I'm from Uganda, and presented. I think one of the reasons as to why African countries are lagging behind in the health sector is because of lack of research, and maybe disregarding research, maybe results. And I'm wondering, every time she speaks, she talks of researchers. So I'm wondering if there are some ways, the advocates, you're trying to bridge the gap between the researchers and then the governments, whose funding for the health sector and other sectors is really, really low.
Okay, you're wondering if there are ways that we would reach the. Okay, I wanted to respond to questions like that in terms of partnerships, because you had mentioned something about partnerships and the enablers and all that. So the way the SDGs works is we work with partners. That's the difference between the SDGs and the MDGs, right? You have partnerships with global partnerships to deliver the SDGs. You have private sector, you have government, you have the civil society. So there's a lot of different partnership academic institutions that are also part of it. So we need to find a way to work together. You need to find how to engage with other partners to, for instance, we can work together in the area of, we are advocating for what your institution is researching on these diseases. We are advocating for it, and we'll take it to government, and then we take it to the people to say, okay, this and this are what you must do, like Juliet has said, in most cases, to say this and this communication is very, very important. And then you also need the private sector, who will be looking into possibly production of the different drugs that are needed. So we all need to work together to achieve this. And also another thing about the specific partnership of the SDG is that it's made it possible for us all to relate on the global policy platform, right? So as a before, you could possibly relate within your institution, and then your institution had somebody that communicates to government. But it's much different now. We can relate within global policy platform. And most of this are reported at the UN level. So government actually, there's a voluntary reporting by government to be part of saying, someone was asking that how do we ensure that this is a global report because of the inequalities between countries, right? So the problem there might be that some countries will not want to come forward. So that's why we also work as advocates, in-country advocates, to ensure that, look, our government, for instance, the UK has not reported on the SDGs, and we are working on that within the UK to make sure that, look, the UK government does what it has committed to implement the SDGs in the UK. So where the funding comes, you wanted to know where the funding comes. Where the funding comes. The funding is going to come from government. The funding is going to come from government. The funding is going to come from other international funding organizations, right? The funding is going to come from, for instance, partners like your institution, because if we are working with your institution, then what we want to do is we want to look at areas where we can cross-fertilize with what you are really doing on ground. So the funding is going to come from all the sources. And that's the commitment we have to make. That is the sacrifice we have to make if we want to see changes. I haven't said achieve, but if we want to see notable changes, improvements in global health, this is where the funding is going to come from. We are all going to commit. We are all going to work together. We are all going to partner together and take our own different areas, our deliverables. The UN, what the UN is doing is to go by year deliverables. In 2016, that's as of July 2017 now, the UN will be considering some goal areas and how there's been improvement. In 2017, some goals will be considered, and goal 3 will not be included in that. Goal 6, goal 7, goal 11 on inequality, some goals will be considered. But what we have to think about now is how do we look at these goals that will be considered in the perspective of goal 3? What are the linkages across these goals? Because when we're talking about clean water and sanitation, goal 6, you know, it has a lot of impact on health. When we're talking about clean energy, clean and affordable energy, it's got impact on health. When we're talking about responsible production and consumption, goal 12, which will be considered, it's got impact on health. So we need, and well-being especially, responsible consumption. So we need to look at all this.
Interesting. Right, I mean, just before we go, what time do we finish, Aaron? Is it 1:30?
Well, I think once 4 people have yawned, we close down.
Okay,
let's see who would like to speak.
Let's get some people who haven't spoken before. Yeah, put your hands up and want to speak.
People who haven't spoken before, let them speak, and then we'll finish.
You haven't spoken before, you haven't spoken before. Who else hasn't spoken before? Yeah, these 3 people.
We'll have those
Let's
three,
get these
and
3
then,
all in a row, okay? 1, 2, 3. You get the last word. Okay? You?
I was just kind of I was just kind of wondering what everybody thought. You hear a lot. There's been a lot spoken about working in partnership and getting involved and offering our own expertise and that sort of thing. And I think in my experience in trying to get involved with any sort of agenda in this general field is that I think a lot of people are looking for funding and less for time and expertise. I can bring what limited time I have, but I can't actually give much money that's going to make loads of difference. So I guess I think it's really great to think big picture, let's all work together, let's work in partnership, but specifically how can we go about that? Because I think big NGOs and different organizations, they have their own governance that they need to work to. They have their own teams that they pay people to do this, so they're looking for money to make their own organization function. And so specifically, what can we do to get involved to push the agenda forward beyond just, you know, working together and working in partnership? Like specifically, how do we do that?
Support the concept of income plaza.
Yeah, which is
basically a linkage for all these things.
Which is the point you made earlier, yeah. Okay.
I suppose one of the things that struck me about the goals is that some of them appear superficially to be more applicable to developing countries and some more to the developed countries. I was wondering if maybe Juliet, when you were kind of lobbying Parliament and that about trying to get involved, do you find that there's resistance to some of the goals above others, and so I suppose say our government would already have some pre-existing agendas to say hunger use against alcohol, and whether that's they sort of try to incorporate that into.
Why don't you save your answer and we'll have everyone speak, and then they can summarise their final.
There's the question of obesity as well in Western countries, And so the last question, was that you? Did you want to speak the lady behind you?
Yeah.
You've spoken, haven't you? You haven't spoken, have you?
No.
And you haven't spoken. But let's take you two and then we'll finish.
Well, I was wondering about universal coverage and quality, because I see that low-income and middle-income countries are now dealing with the burden of communicable and non-communicable diseases at the same time. So it's really hard to deal with cancer and expensive treatments while we're still dealing with diarrhea, for example. I'm from Brazil, we're kind of in the middle of the road, but we have universal coverage, but we spend, for example, a lot of money, and a patient can get 3 CT scans, for example, in a cancer treatment, but he dies before he can actually get the treatment. So we spend a lot of money, and actually sometimes we can't have the outcome we wanted to have. So I was wondering, what do you think should be the best way to address this problem?
Okay, and the lady behind you.
Yes, as last speaker, I really wanted to go to the first question that wasn't answered of the woman. It's about it's about restriction of childbirth and how we can manage this. I think I'm a medical student from Holland, and it's my perspective that I think that it's quite important for the future. that we put a lot of effort in this, and I really have no idea how this can be done most effectively, but I think maybe one of you can.
Okay, well, let's sort of finish now with summaries from the three people on the panel. We'll sort of finish about, I guess, 1:30.
Yeah, I'm sure that some people would like to leave, they've had a busy day, let's say they're free to do so, and those who would like to stay behind and have a chat, we can certainly
okay. All right, well, let's take a sort of 2 or 3 minute summary from each of you on some of the things you've heard and some of the things you're important. That's a challenge, 3 minutes each. Elizabeth?
Your question is a very good way to summarize for me, okay? And thank you for that question because it's important. Right, we are working on the UK platform for now, right? And in our engagement with Parliament, we have realized that although only 3 of the parliamentary committees are engaging on the SDGs. That's the Women and Equalities Committee, the International Development Committee, and the Environmental Audits Committee. Now, the International Development Committee is a very strategic committee for us because then we can look at a lot of other areas like Africa and globally, they work globally actually. So we can look at all the areas where the UK is funding in terms of development fund. That's what they work on. So we have had very good interest from Women and Equalities Committee because of the gender inequality issues and trying to raise the number of women in Parliament and saying that women are the best to discuss issues that concern women, especially things like women's health, gender pay gap and all that. So we have had so much interest from that. And also, in terms of the Environmental Audit Committee, they work with the local authorities, so because they work with DEFRA. So they work with the local authorities, so to know what about localizing the SDGs, which is another good area for us. But the thing I want you to know that differentiates the developed countries from developing countries is still what I've talked about, and what is also talked about. He's been working on sustainable development for 27 years now. The developed countries are very high on the threshold already. So it's not so much an issue for them. That's why you see so much concentration on Brexit and America first. And that's why we're going to have a lot of problems very soon, because all the funds are going to focus in and not out. So we need to think on new strategies for Africa and other developing areas, least developed countries, small island states, to think on how to fund the SDGs. So it's not so much that they're not interested, but it's just that how many people actually have most of these challenges in the UK, for instance. So the policy priorities are different. That's it. Thank you. Okay.
First of all, I'm really pressed to answer her question, and I think that funding issues for me is the frustration of missing out real community leaders that are actually doing the work and not talking. I want to see funding given to practical, sustainable ecosystems that are working. And I believe that that can cut down complete nonsense and bureaucracy that we've got. And I feel that community leaders who are known to the community properly are being missed out for various bureaucratic reasons. So to answer your question, what I would love to see is people who are really engaging. So that is for Africa, that is, and even here as well. So I would love to see that kind of feel. I would love to see not a top down. I want to see it from here. Bottom up, yes, bottom up here. So I want to see it from like that. And then I don't believe that the rich people are the problem. Actually, I'm very different. I believe the middle people who are trying to come up are the problem. Right? So when you're rich too much, you want to give back. So I believe it's these middle people that are preventing the kind of issues we are seeing. So resources need to be given to the right sector. To answer your question on partnership. Partnership is a very hard thing. Even 3 people sitting here today, if you don't agree, you cannot work well. So I believe that while we are choosing partnership, we need to select good partnership and collaboration. And I hate the word partnership, personally. Because what is partnership? I always say to people, I want us to be using perhaps a flat hierarchical system which we are all equal partners in this. There is no head. Yes, you can take lead, but I believe that it is equal partnership that respects and brings integrity. And the next one was obesity and Europe and the things of you're saying here. Actually, all the issues that are being discussed with sustainable development goals, I believe, affect a human being. So the issue of water, for example, currently in Britain, what we are seeing is all the water pipe systems which are trying to be changed cost millions. So water pipe system, your water that you're drinking from Leone, I went there looking the other day, that's just me doing my research, and I thought, you know, when you're looking at the water drainage system, we need to think about that. So my 3 points to finish off with, just a minute.
Very quick.
Yeah, so to finish off with, what am I wanting to see? I want a fantastic, healthy nation for every single person in the world. And that is a challenge for Imperial College students.
And 2?
And 2, oh sorry, and two, the second challenge is every single person that leaves from here, because remember, I came here to do my research. I went to London Metropolitan University and I was the second student when we were competing in somewhere. So the second thing is you pick up on a challenge in sustainable goal development and make it a reality.
Okay. And, okay. In your comments, maybe you can address the question of the last lady about population as well.
No. I don't think I will because of the time. I would just like to say that I'm disappointed with these SDGs. I think they try to cover everything without doing anything. I think that, for instance, these two here are completely different from those up there. How on earth are you going to stop the traffic accidents? It's just a crazy goal, in my opinion. And sadly, the treatment of the substance abuse and narcotics is going up. At least we have the tools to do the others. And I think the main thing that we've got to do is to use those tools. I showed you a whole pile of improvements, but all those improvements emanate from countries which have good governance. And I like the example of Kenya, where it's been relatively, shall we say, peaceful and had good governance for the last few years. There are more universities there, a much higher education level among the local people, and I think that needs to be across all the developing world. We could get there. I don't think we're going to get there, but just like the Millennium Development Goals, I don't think they were a failure. It's a question of a glass half full or a glass half empty. If we've improved and made those improvements, we've done well. And it's going to be the same with these targets too. I'm sure that we'll get a long way towards many of them, but in some countries, sadly, we won't because of poor governance. On your behalf, can we thank Francis for bringing the guests? It's just a little bit different, and I hope you found it stimulating. And thank you, Elizabeth. Thank you, Juliet. And I don't know what you've got in your phone.
I like your
But anyway, thank you, and thank you also for the non-course members at the back who came and participated.
Yeah, and thank you for putting it on, because it's always great to be here, and thank you all for your questions.
Thank you very much indeed. Lovely to meet you.
I'm not sure what happens now. I don't know if where do we go now, Aaron?
Now you can go out of the front door and go home.
That's what you did. Thank you.
I'm sorry to come on.
Yeah, I really want to know.
When you're ready, we got an interview. Do you want to say something to just a bit of summarize of what
That's right. The door was left open for too long.
I want to be with you.
Yeah, what was you capturing around? No, but also.
We all know this.
Yeah, so you're conscious of this and go.
Yeah,
a lot of people.
Money
I think
okay, cool. They take 8 pounds for administration. Okay, cool.
You want to throw them on the
their ambitions.
Now, Facebook.
You want to answer some questions?
Yeah.
You're doing research. This is what they look like. This is
7 children.
Devastating.
It could devastate.
It could devastate.
Yeah.
Contact me. I want to I need to write it here.
This was from Radio 4, you see, and today there was a phone-in program about the NHS. And almost the last question was this.
I'm not going to say no. The issue is that I was connecting with one lady.
Sorry? Yeah, we're still good. Yeah, we'll be out before 6. Alright, you just tell us your name, if you move a little bit back. Okay. Okay. Thank you very much for giving you a little bit of busy time to speak to the audience that are watching you live on Facebook in terms of the SDG 3 that has been discussed right here at Imperial College, London. I know you did answer, you asked for a question. Maybe you want to say that question again, or you just want to go straight into what you feel about the whole session? And I still need to get your name as well, please.
The goals that we discussed this evening, they originated with the Millennium Development Goals, which were 8 in number. So all these things we're talking about, they were included in the goals, and the benchmark was 2015. So now we've passed the benchmark and we haven't achieved those goals, and so now we're expanding it to 2013. So one of the crux of this matter is that I call it, well, not necessarily administration, but people talk about we need to give so much money, so much money. What is happening is that, say a project costs £10,000 and they spend 8,000 on administration and only 2,000 goes towards the actual project. So that's what's happening all over the world.
Thank you very much. Thank you. Are you on Facebook? Are you on Facebook?
Yes,
Yes. Can you phone? And then I'll send the link to you. Where's the phone? Okay, okay. I'll give you the name. Where you'll be able to watch. Yeah, we're still live.
Yeah, but can you always go now? I can't see myself again.
Oh no, no, it has to be played back. We have to play that back.
I'll just
the whole system in Tanzania and Kenya and Uganda, but the DRC in Nigeria,
I was going to give you mine. Okay,
yeah.
What's yours?
And the statistics get
07.
a lot of them.
Something which I mentioned to France is that there's a hospital ship that goes all the way around Africa. It's amazing. Yeah.
I will send you the link.
So play back then, let's see a little playback.
No, it's still live stream. We can't play back now.
Good. I've got to go.
Give me your name, write down your name. Young man. Are you still doing media thing?
Sorry?
You still doing media?
A little bit, yeah. I'm mainly doing projects. Mainly doing environmental
What projects are you involved in now?
Well, we're building, we've invented a type of house, rapid build house, which is made through blowing a giant ball up. You blow up a 4-metre ball and then cover it with cement, take the air away and you're left with a house. So I'm looking at partnering with African NGOs in order to build these. We're going to get funding to build 9 free houses. We want to go there, build them and give them away. And film it.
And then by the time the money you get to take you there and to put you somewhere to stay and to feed you.
Well, not really. I mean, in actually, to build one of these houses only costs £1,500. I've built one in Guildford. So, in terms of cutting down costs,
Oh, you want me to set what you want me to say?
Just give us a summary. If you move back a little bit. Okay, just give us a summary of what took place right here at Imperial College today.
I mean, what we've just had today is the culmination of a course that Imperial College does with a lot of students that come from Imperial and outside as well. And at the end of that course, they invite GlobalNet 21 in to bring other speakers to discuss some major issues around health. So today we discussed the SDGs, the Sustainable Development Goals that are meant to be implemented by 2030. And we looked at some of those goals, we looked at the targets, we looked at how realistic they were or whether they weren't realistic at all, and we looked at what needs to be done politically and by communities in order to make it happen. And it's a really great discussion when you have a GlobalNet audience together with students. It becomes vibrant, it becomes alive, and it becomes different, and it's really worthwhile doing it that way.
Okay, and how would those that want to know more about what you do, where can they find you and all?
Oh, if they want to know more about GlobalNet 21, I would suggest to them they go to the Meetup site, which is meetup.com. Search for GlobalNet 21, and they can see our Meetup group, which has got nearly 8,000 people in it. And if they join up to that, they will get information about all of our events. We have about 75 different events a year. Some of them are online webinars, some of them are meetings like this, so they're very different. So if they do that, they can find out about us, they can join up, and they can take part.
Thank you very much. Well, I'm sure you've all been following the proceeding. We've only got less than 15 minutes to exit the building. Nigeria Diaspora has been bringing us to you live from Imperial College London in Paddington here, where some of the issues that have been discussed is got to do with the SDG 3. I'm going to speak a little bit, just a little bit on it when I go on my show tomorrow called Nigeria Voices. I'm still trying to bring, one of the speakers as well to have a word with you, Juliet Macapila. I hope you've enjoyed it. I hope we've been able to learn so much from some of what has been discussed and some of the questions that have been asked from some of the students. Again, as usual, we are live from London Imperial College, where we've been discussing the SDG 3, whether that could be achieved in 2030, which is just about less than 13 years away. But the most important thing is, like I keep saying all the time, do your own little bit, and the world will be a better place. We can't solve all the problems of this world, but we can continue to inspire. We can continue to work very hard, and we can make sure we deliver the goals, not just the United Nations. Yourself as an individual, make it happen as well. I need to get Juliet Macapila to quickly give us a summary of what has taken place, and then we'll be calling it off a day. Tomorrow, Nigeria Voices 3-in-1. Make sure you join me. Lady Chief Peter Winnett will be on the show, speaking to us on Igbokoda Hospital, which is something that relates to what we're here today as well. Remember, SDG 3 is got to do with well-being and health of the young and the old. So she'll be telling us what it's all about, the fundraising coming up on the 22nd of July 2017. Make sure you get your ticket, make sure you support. Also, I'll be bringing Stephanie Okafor, residential consultant, to give us the reason why a lot of our, Africans, not just the Africans that are going through difficulties with their landlords and all that. The last speaker that will be speaking right in the studio will be Dioba Authentic, telling us more about his solid single that just came out the 25th of June 2017. Again, my name is Olayomi Koike, and thank you very much for everyone that has joined. I can see you, Prince Eze, Gini Sola, everybody, and those that cannot even see now. But the most important thing is I need to get Juliet Makapila, because we need to exit this building in less than 15 minutes so that she can be able to explain what has taken place today. Thank you, thank you, thank you, and we really enjoyed it as well. Okay. Before Juliet Makapila, we've got. Okay, Anna's just going to give us a bit of summary of if she has really enjoyed the session. That's what I want to know from you, and what you are thinking you might do to create an impact on what you've listened to today.
Okay. So it's been a privilege to be here and to listen to these two amazing speakers and to have the chance to really ask questions. I think. Yeah, that's the main point from today, that we've been able to get feedback on what our questions are, and we've had offers to kind of keep in touch with Elizabeth and Juliet and to learn more, and to have those connections and networks to kind of bring up this new generation in informing us and giving us a more outward approach as to where we're going to go in the future, and the things that we really need to address. I think tonight has really highlighted those. Yeah, and it's just been a privilege to be here and to listen to these talks.
And thank you very much for joining us.
Thank you.
Thank you.
And
now we've got.
Thank you to Hannah as well, because I've asked her to do an exercise with me. So her first task is to put me on her Facebook to start practically asking questions for on behalf of the questions over here in Imperial students. So I've requested her, and she's kindly said she will try, no pressure at all. And the question is, we've decided we're going to try and have a question and answer session where she'll be impacting upon through Facebook, and she'll be sharing it to her students. So she collects the questions, and that means that we are able to action through this kind of Facebook means. So we'll test it with Anna. Sorry, Anna who?
Hannah Locke.
Hannah Locke.
Yeah.
So a very inspiring student who actually asked several questions, and I love the question which we will be seeing, and thank you so much.
Thank you.
If we will be arranging, I've given her my phone number, so she will be arranging how she will be contacting me. We'll have sessions and people can follow that, and I believe action speaks louder than words, and here we go now. Thank you.
Thank you.
Okay, we need to be out of here in less than 10 minutes. I just want you to round it up now and close the session and say big thank you to all those that have followed us on Facebook as well.
First of all, a very big thank you to Imperial College. A very big thank you to the collaborative partners who are here today, UK Africa Diaspora Forum, led by myself, and Global Net 21, Francis Seeley, who is the founder, and of course the lecturer who was Alan. Thank you so much, Mr. Olayami, who is capturing this information for you today, so we are able to see the biggest, the greatest School of Medicine learning and how they're going to impact on sustainable development goals. SDG, we want to achieve the SDG by 2030, and we are here today with the we've been here today with Imperial College students. We are excited for having that feel. I want to thank Olayomi for capturing this. This is all voluntarily. We have done this voluntarily, and we want to seek partners to be able to ensure that in whichever direction we are going, we are combating and improving health of the nation, both here in United Kingdom, where we know there is a deficit in the NHS, and also across Africa. The challenge for you today is good, healthy nations and good quality health for goal number 3. Every single person has a responsibility to do. And thank you so much for watching. Thank you so much for being with us here today.
Okay. Well, like she has said, now we call it that it's just 10 minutes to 6. I hope you've enjoyed it. Join me tomorrow, Niger Voices, between the hours of 7 p.m. to 9 p.m., 3-in-1 speakers will be discussing and will be debating, and we'll hope to learn from there as well. Thank you very, very much.
And also, before we leave, thank you very much to all the students who were in this classroom, and to all those students who have decided they will do something about the issue of sustainable goal. We've seen a very enlightening, interesting session. Many, many thanks to all these students. So a big round of applause for them. Thank you.